Ladies and gentlemen, we're going to begin wrapping up. The next segment is going to be inviting the tri-chairs of this conference who've been planning the conference, shaped its objectives, pointed to the need for people to express their views. This was not an easy conversation. And of course, it brought in many points of view. We talked, generated ideas, and now there's a couple of questions. One, what are we actually walking away with? Which is what we've just talked about now, the key ideas that you wanted noted in terms of the construction of a federal framework. We should hear, between now and the time we leave, where this process goes from here and also how you can be engaged. There's a lot of work to be done. There's a lot of work that went into this so far, but there's a lot to do ahead of us. So to start on that, I'm going to ask Dr. Gregson to start sharing his views. It'll continue with Jim Wilson, and the last word and the closing remarks will be from Dr. Greg Taylor. Over to you. Is this yours?
No. Thanks, Dan. Can everybody hear me? All I can, to start off with what I've learned, there's a lot of articulate people here with a lot of great ideas. I think that's the first thing. So congratulations and thank you for your input. And I sincerely mean that. I've seen a lot of people with really severe physical, psychological, and financial suffering. As a person who's been treating patients all my life, I mean, I empathize with you. I wish I had something today to help you out with. I have to be honest with you, I don't have something today. It doesn't mean we won't have something tomorrow. I don't have something today. I also heard a lot of concerns about physician-patient interactions, and that's concerning for me. And I think it's something I have to take back to the medical community, that we obviously need, in some way, shape, or form, better ways to message with patients who are dealing with really complex and chronic medical conditions, how we actually speak with them, how we communicate with them, and how we move their medical care forward, because some of the stories I've heard today really are difficult for me to hear. And we will, I'm here representing the Association of Medical Microbiology and Infectious Diseases Canada. That message will go out. I'll be discussing this with the CMA and our partners. So I heard that. I also heard from you a lot of unanswered questions. You all have questions, they're not answered. And so there are a lot of questions we don't have the answers to. And this is not the first conference that's been held on Lyme disease. Sorry?
That's the first one we got invited to.
Well, it's the first one I've been to, and it's probably going to be the last, unless we have them every year, right? And my hope is that the next time you have a meeting, that I might not have, not me, we might not have all the answers, but we'll at least have some answers for you. Right? That's my hope, okay? Because I don't think you should be back here in 5 years having the same discussions. That's not going to be helpful, right? You've covered, I can't cover everything you guys have covered because I don't have that much time. You've gone over issues with surveillance, prevention, and education, and we're all on board with that. There's no issues there. I think we've really talked about a better classification of people with illness. Dr. Bowie mentioned it. Our colleague David Patrick from Vancouver has mentioned this sort of classification syndrome of, you have a positive test, you don't have a positive test, you have disease, you're treated. I think we need to capture people, everybody who's being treated, into one of those categories and get them into a database. So that would, it doesn't really matter which way I classify you, but we do need to know who you are and how you've been treated. And that includes people who aren't in this room who've been treated with Lyme disease and actually got better. Some people do get better, I hope. The patients I've treated with Lyme disease, all the ones I've seen, of course, have been cut from Europe, but that's just my experience. So we need to get things classified, and then we need to get everybody into a database, because I hear people here, they've all been treated with antibiotics. Well, how many people have not been treated with antibiotics here? and have symptoms, chronic symptoms. So the vast minority are not. How many people have been treated with long-term antibiotics? So a large number of people. And I guess my question is, the stories I hear, some people get better, some people don't get better and go on different drugs. Some people get better and then go off and come back on drugs. And I think the loss in that data is that I don't have that information as to who got what and who responded to what. And I think it's really important that, at least as a baseline, we start enrolling people in observational studies as to what is actually happening. I've heard that there's persecution of physicians. I'm not involved with the college at all. I'm just involved with the science. And I apologize for you because I do come from a science background. I am evidence-based. And it's hard for me to move off the evidence block. I think the other issue is we need to really get better access, whatever the underlying cause of patients' illness are. When they have complex and chronic medical conditions, we need a way to get people into clinics that deal with that in a complex manner. So we've got multiple groups of healthcare providers engaged with that. Obviously, from what I heard, seeing 17 physicians, knowing you have a chronic condition before you see the second or third physician, it doesn't help you to go see the 15th or 16th or 17th. We need to have a better process for dealing with that, and we need to establish that in some basis nationally. I can't guarantee that because the public system is actually provincially funded, it's not federally funded, but those recommendations I think are reasonable. We can support those for sure. The other comment I wanted to make is there's been some repeated concerns about disability, how one defines disability, and from our perspective, disability is a functional classification. It has nothing to do with your diagnosis. There's people with Lyme disease who are better and are working. There's people with Lyme disease who have, post-treatment have long-standing symptoms, and it's really your functional capacity. It's not your diagnosis that does that. So I don't know where this idea that we're trying to prevent disability comes from, because we're really a functionally based organization. And I'd like to just end with the question about how we're going to engage. And I want to highlight, we're not always going to agree. I don't always agree with my colleagues. I mean, you'll see us at rounds on a Monday morning. One guy will say, I'll use this. The other guy will say, I use this. We disagree. And that's okay. I mean, I can disagree with my colleagues, and that's fine. Going forward, I think we need to really think about how we want to disagree and who we want to be seen we're disagreeing with. Because the communication we have with the public and with the press, when we start to disagree on issues, they get confused. We're confused. They're going to be confused at what the right answer is. So as we move forward, at least initially with the first portion of where we go with the federal framework, my hope is we can identify issues that we can agree on. We can communicate those issues. If we don't agree on something, we're not going to be able to get it in front of the public. But we can communicate on those issues to the public and to the government and get forward motion. If we come out divided, we're not going to get forward motion. And I think Dan said it quite aptly in the beginning of the meeting here, that we're going to go forward. We need to be tough on the issues and soft on the people. I want to thank you for not sending me any hate mail in the last couple of days. It's okay. It's coming. I won't be surprised. How would that be? Nobody's thrown a tomato. Nobody threw a shoe. And to be fair, at the beginning of the HIV epidemic, there was people standing at the back of the room throwing stuff. So I appreciate how you held those values that Mr. Normando requested in check, I guess. I'd like to thank, I think that this meeting is an opportunity for us to move forward. A lot of people have put a lot of work into it. I can't name them all individually. Dr. Taylor in particular, I would like to thank. The Minister of Health, I'd like to thank. And Elizabeth May deserves a thank you for putting this forward. I know you're familiar with the fact we had some issues with some of the wording in the initial act, but I do believe that this is an opportunity for us to move forward on a positive note. And thank you all for your participation. You've really done a great job.
Thank you. Welcome, everybody. This has been a great audience, and I think a great conference, a great chance for us to get an awful lot said in a short period of time. And I think with all the input and the very good comments from everybody, we managed to achieve that. I had a whole big thing written that I was going to read here, but you guys covered it for me. So that's fantastic. So I get to keep this much shorter and get everybody who's tired out of here and on their way. Dan, I just wanted to reassure my comments yesterday regarding AIDS were most certainly not directed at you. I was speaking more of the global shift that happened when AIDS started affecting the heterosexual population. That is when the research funding started coming. And my point being there is, here we are now. We are here now with Lyme disease. We need research dollars. We need patient involvement. We need ongoing multiple centers of excellence. We need cooperation that we just have not seen before in this whole Lyme disease discussion. And I think the momentum that we've seen here today, we have the opportunity right now to build upon, and we can nudge the Minister of Health and all of our provincial, their provincial counterparts to head in the right direction to make sure that the patient and their experts are from this point forward equal partners in all aspects Lyme disease, all matters of Lyme disease policy. That has got to be the foundation from this point forward. As you see from some of the extremely good presenters that were here during this conference, that wonderful balance came from the fact that we could get together and bring this conference together as it was. So we saw different opinions, opposing opinions. That is exactly what we need. We need that continual opposing opinion. And that brings me back to what I had said earlier, is that science, to become evidence, it requires debate by all the stakeholders. If it's not debated, it's not science, it is politics. Politics requires debate. So either way, we need debate, and it's got to be open and transparent. And if it's not, then it certainly isn't evidence when it comes to science. As a reminder, too, relative to the patient involvement, the Canadian Institute of Health Research, in their documentation, actually outlines, and they state quite clearly, patient involving from the beginning yields best outcomes. And then they reference the international experience that shows that the best outcomes only occur when the patients are involved right at the design stage and at the planning stage. So that's good information already within our Canadian Institute of Health Research. We want to build on that. From this point forward, we are equal partners. And thank you, everybody, for coming. I think it was a very good conference.
Thanks, Jim. Can everyone hear me okay? Great. I, too, like Jim, had a prepared speech. Mine was done by a speechwriter. And I have to apologize to Corey when I go back, but I'm not going to use it. I wish I had some words of wisdom to give you, but I don't. You've already said all the words of wisdom. And I thought that rather than a prepared speech, that as you've done, I need to speak from the heart. So I want to start by thanking everyone, thanking all of the participants, thanking my tri-chairs, thanking the planning committee. I think Dan and his team have done a spectacular job. Staff from the Public Health Agency helped prepare this. Have done a great job, and I'll be thanking them tomorrow.
We could do it today.
can we? Okay. Thank you. If I was to describe my experience in the last few days, and I've been watching and listening, the only thing that comes to mind is, wow. That's the only thing I can think of. It's just been an incredible learning experience for me personally in the last few days. And it's just been difficult to describe. And difficult to describe the pain that I saw in people. And the anger that I saw in people. But as one of your facilitators said, the hope. And the hope that I've heard throughout has just been incredible. People aren't here to bitch and complain. People are here to make it better. And that's great. And that's where we're all on the same page. That hope and clearly the commitment and clearly the altruism, because every comment I heard was about making it better for other people and making it better for other Canadians. So we're on the same page for that one, because that's our job too. I think I also wanted to thank you for a very vivid reminder with us where we work. And I don't get a chance to talk to real people most of the time in my job. I talk to representatives and I talk to politicians. I don't get a chance to talk to real people like I used to do when I practiced medicine, clinical medicine. But the vivid reminder that if what we're doing at the Public Health Agency and at the federal government is not making a difference to individual Canadians, then we're not doing our job. So, and I want to thank you for that. That's very moving. It's very moving, and it's part of why I do this job. People ask me why I left family practice to go into public health. In family practice, as you know, you can make a big difference in the lives of 2,000 or 3,000 people. In public health, you get an opportunity to make a difference in the lives of 37 million people. And we need to make that difference, clearly. So thank you for that reminder. The other reminder is we must engage Canadians better and more. We must engage patients better and more. And you don't need to hear that from me. Our new Prime Minister has also said that on numerous occasions, engaging Canadians. So very much in that spirit, I think, this event that we've had the last few days. I'm typically optimistic kind of person, and I like to focus on the good things. So what's crystal clear, and I think we're lucky as Canadians, in fact, our colleagues in the States look at us in envy, believe it or not, from the CDC, Center for Disease Control. We're natural collaborators. And so I didn't hear anybody today say, they know exactly what to do, leave us alone, we'll get it done. Not one person. Everybody's saying, we need to work together. So we're natural at that, and I think we need to be lucky and proud of that. I like to focus on where we agree. Everyone has agreed we need better surveillance, both patients and ticks, no question. Everyone's agreed we need better education, better prevention. I said that at Power in Politics yesterday, people agreed that I'm sure most Canadians would prefer not to get sick at all than be treated well. If we can prevent Lyme disease, then that's the ultimate goal. That's what public health, where I work, is all about, is preventing disease. Everyone agrees we need treatment guidance, improved treatment guidance. We need best practices. So we all agree upon that. And it's really interesting because this wasn't intended to be a consensus conference. This was intended to simply get input and listen to folks. But I hear a lot of consensus. I hear a lot of folks saying exactly the same thing on both sides of the fence, which I think is very positive for the way forward. Certainly, what next? As you know, the Act stated that we would produce a federal framework. I like to put in for action because where I come from, the bureaucratics, if it's not into for action, again, it's a nice document that's not very useful. Back at the ranch, we have all kinds of documents that we've spent hours producing and go nowhere. This has got to be for action. So we were supposed to gather the information, and we will do that, guaranteed. All of the input from this last few days will be posted, free to everybody to see. It's being recorded. That'll be posted. Everybody's going to try and capture as much as we possibly can. As we develop this framework, I think we should do it very quickly. Remember, the framework is a roadmap for action. The real work's going to happen after we get that out of the way and get at the real work that needs to be done. I don't want us to waste a lot of time doing this framework and getting the wording just right. Let's just get on with it. So you will have an opportunity to put in the framework. We will share drafts of that. We'll get input. In terms of engagement, our point of contact is Jim. That's been that way for a long time. And he's our conduit into you. And so we will be sharing, and we'll do our best to ensure that your voices are represented in this one. And I think that you have to remember, this is not the first, although this is one of the best, this is not the end. We do need to, and I want to echo Jim's words, we need to engage on an ongoing basis as partnerships with patients, partnerships with Canadians. That's where we need to go. And so, again, I don't have any brilliant ideas. You have the brilliant ideas, although I must say some of them are great. Unsuck at sharing information. Now, I got to tell you how true that rings. We do surveillance all the time across Canada with the provinces and territories. And man, that could apply to everything we do. Sucking it out of the provinces sometimes. I was particularly struck by the citizen scientists. I thought that was kind of cool. That was really cool. Building on expertise in places you don't expect it to be. And we put ourselves as experts, but it doesn't mean we know all the answers. And I think both of my colleagues have said the science is one thing, interpreting that science in terms of what does it mean and what do you do about it is a little bit different. So I thought that was good. Transparency, that's key, absolutely key. And we will certainly do the best that we can to be ensure that as we go forward, we're as transparent as possible. Building the business case, that was pretty savvy. In the political environments that we live in, when politicians have multiple conflicting priorities, multiple groups looking for money, you got to build the solid business case for investment. And I think there's lots of information here that we'll be able to do to help us build that business case. And then the last one, which I thought the drawing was great, was sex with a tick. So I knew I'm in the right room and they started talking sex with a tick. I thought that was great. Anyway, thanks again. It's been a very moving experience for me personally, and I do want to thank you all for sharing. There's been some really amazing stories that last few days, and you all took a lot of risk. I got to say that, a lot of risk. Revealed yourself personally because you believe that together we can work and be more effectively. And I'm there with you. I look forward to working with you in the future. Thanks so much.
Thank you, Tri-Chairs. First of all, to the question of video sharing, we mentioned the privacy clause when we started this conference. Of course, if there's a camera that was directed to you and you don't want your image used, you got to let them know. It's 2016. We live in a modern technology era. You can do whatever you want with the images, of course. And especially the ones on the tick that was over here, but I leave that to you. And they're going to be selling this soon. Those of you who have other ideas to leave with us, don't forget there's a box at the registration that you can drop them in. And finally, please, safe travels and stay good and stay well. And those who want to join the Lyme, just show up at the front of the room. Alors, bon séjour, bon retour à vos résidences. À bientôt.
I just want to give credit to Janet. Yes, I just wanted to give credit to Janet Sperling, that analogy between science and evidence and politics and debate and everything, that all came from Janet Sperling.
This was good.
Are we ready? Got paparazzi. 2, 3, fight. I need one for right there.